Hi there, Dr. J from Pure Chiropractic here again, and welcome to the latest episode of our video series. The topic for today's episode is one of the most common conditions there is, headaches. Roughly 1 in 6 people have a headache at any given moment. That means well in excess of 5 million Canadians have a headache as you watch this. Even one headache a month equates to nearly 2 weeks of every year of your life being lived in pain, often unnecessarily. Of course, many people turn to painkillers to deal with them, but they aren't without their own problems, including stomach ulcers, stomach bleeding, aggravating your asthma, kidney and liver failure. In fact, the leading cause of acute liver failure is not alcohol, as you might suspect, but over-the-counter anti-inflammatories. Worst of all, these drugs don't correct the cause of your headaches, they just cover the symptoms. One of the things you might not be aware of is the number of types of headache there are. There's typical migraine, atypical migraine, cluster, thunderclap, hypertensive, rebound, sinus, and withdrawal, just to name a few. But far and away the most common type of headache is the cervicogenic headache, or neck-created headache. These headaches center around the base of the skull and upper neck. If particularly bad, they'll spread forward over the head and can refer pain to behind the eyes. The pain can vary from a dull ache to sharp and stabbing, depending on the severity. In fact, many people think or have been told that their headaches are migraines, when in reality, they're severe cervicogenic headaches. Usually with cervicogenic headaches, you'll get increased discomfort when you try and move your head, and the muscles of the neck and shoulder region are particularly tight and tender. These types of headaches are due to irritation of the nerves stemming from the spinal cord. This irritation is caused by misalignments of the cervical spine, the bones of the neck. You can get these misalignments through injury to the neck, as in whiplash, or through poor posture, things like sleeping on your front, looking down when you read or type, or just plain old slouching. Times of increased stress will aggravate your headaches, as the tight muscles will tug and pull on the misalignment. Diagnosis of headache type is difficult and can only be determined following a comprehensive examination. This would include taking a medical history, performing a physical exam, diagnostic testing, and if necessary, medical imaging. We have digital x-ray facilities on site which provide superior images more quickly with less exposure and are more environmentally friendly. Following this, if it is determined that the cause of your pain is indeed cervicogenic, what can chiropractic do? A chiropractor skilled in dealing with these sorts of conditions can restore normal biomechanics to the spine and get rid of your headaches. Interestingly, because there's often a nervous system component to migraines, these can respond well to chiropractic care too. If the diagnosis shows us the problem isn't stemming from the spine, we'll give you the referral to the appropriate medical specialist. I know that these headaches can take their toll. You don't want to work, socialize, or do much of anything. With the right treatment, we can get you healthy and active once again. I'm Dr. J, helping you get back to life.